Vaginal dryness is one of the typical symptoms of vulvovaginal atrophy, which is a condition associated with reduced estrogen production. The premenopausal vaginal epithelium is hydrated and rich in folds, thanks to estradiol, whose values fluctuate between 10 and 800 picograms per milliliter, depending on the phases of the cycle. Hypoestrogenism, in which estradiol levels are reduced below 30 picograms per milliliter, causes thinning and reduced elasticity in the vaginal tissue. Hypoestrogenism also leads to a decrease in blood flow and lubrication, causing persistent dryness over time. As a result, the mucous membranes appear pale, the folds disappear, and the cervix flattens with the vaginal wall. The fragility of the epithelium increases the risk of injury during sexual intercourse, also causing spotting. Vulvovaginal atrophy can present inflammation and redness. The main symptoms associated with vulvovaginal atrophy are vaginal dryness, pain during penetration, and itching and burning caused by inflammation. Urinary symptoms are also manifested, such as urgency sometimes associated with incontinence and increased day and night frequency. During vulvovaginal atrophy, there is also an increase in pH that reduces lactobacilli that may favor the excessive growth of pathogenic bacteria. This can cause inflammation and vaginal infections. A thin, watery yellow vaginal discharge may be observed. When does hypoestrogenism occur? Hypoestrogenism occurs physiologically during menopause and postpartum, but can also be caused by drugs such as chemotherapy and radiotherapy for the treatment of breast and gynecological cancers, or by the use of oral contraceptives. Vulvovaginal atrophy affects 1 in 2 women in menopause, and 70% of those in treatment or who have survived breast cancer. 30% of women who use oral contraceptives show vaginal dryness, while 50% report sexual difficulties, the same symptoms that can also occur during the postpartum period. Despite the implication on the sexual sphere and on the quality of life, the condition is poorly diagnosed. The symptoms are considered embarrassing due to a social and deep-rooted taboo, and for this reason, both the patient and the doctor have difficulty dealing with the subject, generating a silent suffering. Unlike perimenopausal vasomotor symptoms for which the search for support is extensive despite being temporary, menopausal women sometimes accept vaginal aging without counteracting it, so vulvovaginal atrophy progresses over time, becoming chronic.